A word that I've heard used, bantered, if you will, around a lot this year is hope. Hope seems to be the theme of 2022, and I applaud that. I have a lot of hope for the coming year, and I'm hopeful for myself, my family, my friends, my business associates, coaching clients, all that. And what I'm alluding to is advocacy, advocating for yourself. There's an old saying about how you can't drink poison and expect it to harm your enemy. And I'm not advocating harming anybody, but what I'm getting at is the power of self-advocacy, and that can come in many shapes or forms. As you are aware, you're here on a healthcare blog for the most part. I talk about a lot of things here related to health, wellness, travel, etc. But I want to share a few examples of how advocacy was sort of the tipping point in level of care in a couple of recent situations, and then I want to give you some take-home points at the very end that hopefully you will find some value in. And so the first point I want to stress here is that it's important to not assume competency. I watched a webinar the other night through emergency medicine group that I belong to, and it was talking about the crisis of compassion, how COVID and the current state of affairs, primarily in the United States healthcare system, but also around the world, has stressed providers to the breaking point and beyond. And burnout was a huge problem before COVID came around, and now it's exponentially multiplied. So don't assume competence. Don't assume that the person caring for you is abreast of the most recent recommendations or the latest standards of care. There's plenty of information out there on the internet that is both good and bad, dangerous. I'm not asking anybody to play doctor, but looking at reputable sites and coming away with some new studies, new data, and things like that, and bringing that to the discussion can go a long way to fostering a higher level of care. Know what you know and trust that the person you're looking at, confronting, maybe that's not the best word, but having a conversation with about the healthcare issue at hand has some at least degree of competency and level of training because they became certified. But don't assume that it's gospel, that it is the final word or the best answer. That's why there's second opinions. If you are asking for something that you think is reasonable, that you've had in the past for a standard of care, or that you've read about that maybe is a more recent standard of care, you can find care algorithms on a variety of websites. American Academy of Emergency Physicians, American Academy of Family Practice, internal medicine standards, hospital standards for care of a variety of conditions as well. These are pretty well mapped out. There are some areas that are still gray, obviously, but there, for a lot of things, there is a reasonable standard of care. And knowing that can help you have an open discussion about whether or not you feel that there may be a better treatment option available for you and you wanted to explore that. Not necessarily that you're going to get that, but you can explore it. You're free to ask for a second opinion. There's nothing that prevents asking for a second opinion or asking for somebody just to lay eyes on the problem and render either the same or a different opinion. And you can always request a review. I've been a member of a variety of quality committees where we review cases, we review decision making, and sometimes we come up with support 100% wholeheartedly for the care that was delivered. Other times there are some errors that not only are brought to light, but also go a long way to enhancing care and preventing medical errors. As you well know, medical errors are a huge problem in this country, and I'm not immune to them. Nobody's immune to them, and just keep that in mind. Two examples recently. The first is my own example. I brought my son to an urgent care. He's very active, skateboarding, skiing, flipping, all these things that I just sort of cringe when I see. And he had wrist pain. And as we talked to the provider, I said, I'm concerned about a scaphoid fracture. And he said, no, it's not that. And I said, well, I have a fair amount of experience with this as an emergency physician. My own father had this injury that was missed, and he's had 15 wrist surgeries and now a fused wrist that's essentially non-functional. And, that's fine if you don't think he has an injury. You don't see it on x-ray, that's fine. You don't normally see it on x-ray. I get it, but how about we just get the proper splint? And he basically flat out refused and said, no, you don't need it. It's a waste of money. It's a waste of time. You can come back in a couple of weeks if it still bothers you, and we'll re-examine you and take another x-ray and see what we see. And I said, okay, that's fine. That's your opinion. You're the captain of the ship here. You're the only one on deck right now, and there's nobody else to talk to. So that's fine. The next day we went and saw an orthopedic surgeon who looked at the wrist and said, I'm concerned about a scaphoid injury. And I said, interesting. And he said, let's get an MRI scheduled. Let's get him in a cast. Let's get this immobilized before we cause any further damage. And the end result was, yes, it was a scaphoid fracture. It was 8 to 10 weeks in a cast and then subsequently in a splint after that. And so had there not been some advocacy on my part, but also unfairly I had inside knowledge, this would have probably turned out not so well for my son. Second example is a friend of mine who is educated medically, oral surgeon, and she developed just a common eye infection. No big deal. Usually responds quickly, no big deal. But this case, it didn't, and it turned into a cellulitis and facial swelling and sort of a big mess. And I encouraged her to go see a physician. The weekend was long. I felt some antibiotics were necessary, maybe even a shot of antibiotics. And the person just flat out said, this is a nothing thing. This is almost never bacterial. And just go home and wait it out. And she texted me and I said, your eye is draining pus. Your face is swollen. You have fever and chills and swollen glands. This is beyond a simple little eye irritation from some dust or whatever the explanation was offered by the provider. And so with impressing and some heated words, finally did receive an antibiotic injection and got a step up in the care that would have otherwise been missed without a level of self-advocacy and some additional help on prompting and words to say to the provider. So I'm not trying to be a naysayer or bashing healthcare, but in reality, healthcare is stretched beyond comprehension. Many people are just beyond understanding of the level and the degree of the problems that have arisen in our system, and they continue. The healthcare expenses go up, the insurance expenses go up. And the other point is I want to encourage you to listen for clues. A person may offer an explanation that makes no sense at all, or they may utter something that lets you know that it's not about you. Maybe they're sleep deprived, maybe there's something going on at home. Maybe you need to offer a bit of compassion to them and thank them for their time. But keep in mind that there are a fair number of other factors that are extraneous and exogenous. There's a well-documented study on parolees, on how those who go to a parole board right before lunch versus after have a less likelihood of being released on parole than after the parole board has eaten, is satiated, is comfortable, is happy, not hangry or cranky or all that. So it sounds kind of silly, but this same applies to healthcare practitioners. They're not immune to emotions, to physiology, to hunger, things like that. Another point I wanted to bring home is that for anybody who has been part of a team or an organization, you realize that there are A, B, and C players, and they are top level people who always seem to be on their game no matter what the situation, the level of stress, their degree of duress, sleep deprivation, emotional stress. They always perform consistently well. And then there are C players and even D players that they may do okay when things are easy, when there's no stress, when they can go at their own pace, but just ratchet it up a notch and they fall apart. And unfortunately, that sometimes is translated into substandard patient care. And that's just the reality of healthcare. It's how it is. I don't think it's unique to any specific country or location, but just keep that in mind that at times you just sort of have to give up this fight and realize that you can fight another day. You can go to a different urgent care. You can check out of the emergency department and check back in. That happens. I worked in several level 1 centers where patients would butt heads with somebody and they would check out and they would go back through triage and check in again, and I would see them in another room and think, oh, interesting. That's one way to approach it, and not necessarily the most cost effective or resource utilization conscientious behavior, but it is a reality. People are free to choose. People are free to do what they think is right for themselves. I can think of a handful of cases that I've seen where patients have left their primary care office and come directly to the emergency department and been diagnosed with something horrific when they were told that it was just a cold or just a sore muscle or something else. And I'm not touting my own horn. I'm just saying that at times a second look or a person with a different level of experience or a different lens oftentimes can lend to a more desirable outcome of care. So the take-home points are here. Ask for more. Just because a provider says no, this is not third grade. This isn't your parent telling you to clean your plate or go to your room or whatever, sweep the garage. There should be a rationale behind it, whether it's an experience level, it's a literature level, it's a training level. There should be some reason to offer up an explanation about why what a person is proposing may be better or maybe worse than suggested. You paid for the whole visit, the whole exam. So analogy that I recall just pulling forward from 25 years ago and my first start in healthcare was that a patient gets an x-ray. They paid for the whole x-ray, so look at the whole x-ray. If they're there for collarbone pain, don't ignore the mass in the lung. Don't focus in on what is perceived to be their explanation of their cause of the problem. Deliver a higher level of care and ask for the same in return. If there's an x-ray there, you can certainly ask, did you see anything else? Was there anything else worrisome? Can I see it? Can I take a picture of it on my phone? Can you send it to my regular doctor? How do I get the official radiology read of this? Ask for more. You paid for it. Healthcare is expensive. You deserve to get the most out of every visit. And the final take-home point here is it's not the end. Don't resign yourself that this is the final word. There's options for second opinions, consultations, resource utilization reviews, quality reviews. There's a whole variety of options out there. So if you're not fully satisfied with the outcome of a particular visit, tonight's another night, tomorrow's another day. You can always be free to pursue a different avenue and advocate for yourself, your loved ones, your family. I'm a physician, been in healthcare, started as an EMT in college back in, 1991. So I still have to advocate for myself and my family when we seek healthcare. It's just the way it is. It's reality. Hope you found that helpful. Take care. Be well.